It's a story that every parent knows. Getting up in the middle of the night to change a child's wet bedclothes. Yes, bedwetting is part and parcel of this noble job. However, as most moms know, bedwetting isn't naughty, lazy, or attention-seeking behavior. Most often, bedwetting is a developmental issue. This means that most children wet the bed because they haven't yet mastered bladder control. As they grow older, the brain and the bladder will communicate better, even when they sleep, and will help them to wake up when their bladders are full. There may be other reasons too, such as constipation, deep sleep, or low levels of a chemical that is called antidiuretic hormone, or ADH. This hormone regulates the body's water retention and plays an important role in how much urine the body makes. Sometimes, stress also brings on bedwetting, especially in older children. So be alert when you move house, have relationship problems, welcome a new baby into the family, or when your child starts or changes schools. Most children feel embarrassed or ashamed by these mishaps. Don't make a fuss or reprimand them when this happens. Rather explain to them that it's normal and that as they grow and their bladders get bigger, it will eventually stop. Some simple steps can help you to manage bedwetting. Encourage your child to drink more during the day. Limit any drinks after 6 p.m. Make going to the toilet part of the bedtime routine and keep clear from caffeinated drinks. You can also put a waterproof sheet on the bed and let them wear washable waterproof underwear at night. Remember that teasing your child about bedwetting can make the problem worse. Some children may be too scared to go to the toilet in the dark. Give them a portable nightlight to make it easier for them to go to the bathroom. The good news is that most children stop daytime wetting when they turn 3 years. Nighttime bedwetting, on the other hand, usually only stops at 5. The secret is to be patient. Many preschoolers and even some primary school children will still wet their beds occasionally. It's also slightly more common in boys than in girls. Discuss your concerns with your general practitioner. The doctor may run some tests to rule out possible medical conditions. Also remember that emotional distress can cause children to start bedwetting all over again, for example, from pressure at school. Doctors distinguish between 2 types of bedwetting, namely primary and secondary bedwetting. Primary bedwetting means that the condition has been continuous since early childhood without a break. Secondary bedwetting starts again after a dry period of at least 6 months. The doctor may run some tests to rule out any possible medical conditions like urinary tract infection, diabetes, or anatomical or neurological problems. In extreme cases, your doctor may recommend medicine or a bladder training program. Counseling or even hypnosis can help children with emotional issues. You may also want to talk to your doctor about bedwetting alarms. These will alert your child and tell them to go to the toilet. This system also teaches them to wake up before they wet the bed. Praise your child for every dry night to boost their self-confidence. Remind them that bedwetting is nothing to be ashamed of, that many other children do it too, and that it will soon stop. Remember, one of your most important duties as a parent is to ensure that your children feel safe and loved as they grow.